As promised, we are here. We are doing test-taking strategies. I think there's a little something in there for everyone for this video. It doesn't matter if you're taking a HESI, an ATI, the Ngn Nclex, or any test really. I want you to know that these tips and strategies are not tricks. I don't believe in tricks. Nope. I believe in old-fashioned, work hard, do it the right way, kick ass on this test. So yeah, there's no tricks. If you're looking for tricks, I'm not your girl. Now, a lot of you have taken advantage of our complimentary Oh My God packet last year. Like you got it for free and you found out indeed, that was the way to pass the test. I love the calls and the text messages from everybody that keeps passing. That makes me feel really good. I had a gentleman, shout out to my Ryan, who failed his test 9 times. This was the 10th, and he used my materials, and I'm so excited because Ryan's a nurse now, but whatever. Now, if you did not get the complimentary Oh My God packet, and you instead waited until I had to sell it because it was just overwhelming, all the requests, you need to know it's still very affordable. It's super cheap. And let's just be real here. You and I both know that no one else on YouTube puts their entire nursing school curriculum on YouTube. You and I both know there is 400 plus videos on everything, everybody's system, and it's for free. So yeah, just the written materials, you may have to kick out a little bit of money, but it's a simple type of deal to remember, right? 8 for 88, 7 for 77, 6 for 66, pick 6, you can pick whatever you want, and we kick you back the most important materials you need for this test. This particular video comes right out of the Oh My God packet. It's on page 17 and 18, which is why I brought it up. Now, just in case you're brand new to this channel, remember the Oh My God packet is the study guide of the world to get this test passed. What do I mean of the world? Well, you know, we get a lot of people from Canada, Australia, Philippines, UK. We get a lot of people from all over the place, and what they have shared is that this is the way to pass your NCLEX. So, you know, give us a buzz, text us if you need it. But again, what I'm doing today is on page 17 and 18 in your Oh My God packet. Okay, now that's one packet, one really important packet. There are 8 total pink packets, and if you've ever failed your tests before, you know that these are the subjects that the Board of Nursing has in their test plan. I'm going to go over it quickly because I want to focus on test taking strategies. So we have the management of care, which is 20% of your exam. That's packet number 2. We have infectious diseases. You know you got to know contact, droplet, airborne, and all that stuff. That's packet number 3, and it even has a select all list of all the diseases you kind of got to know. We have our EKGs, and that is packet number 4. It goes with the video so nice. And then we have our medication categories, and that of course is packet number 4. And I'm sorry, 5. Can't count. Told you I failed math. Pharmacology is packet number 6, and psych meds, sorry guys, psych meds is packet number 7. And remember, I said there were 8 of them, so we've got to find what's missing. You guys know what's missing? Hello? This most important packet of all, procedures and reduction of risk. Now these two together, procedures, reduction of risk, Oh My God packet, they have your basic care and comfort, which is one of the top areas of failure. And then just this, reduction of risk, procedures. This is now #1 on the NGN case study. I mean, the NGN Nclex exam. It's #1 area of failure. So what I'm saying to you is it doesn't matter which ones you want, how many you want, how many you can afford. You go all the way up and down the little channel there. You can get 8 for 88, 7 for 77, 6 for 66, and on and on and on, okay? So if you need materials like that, I highly suggest you just text us. My number's always up here. HETV is the name of the YouTube channel. The phone number to text is 216-410-0936. Now, shall we get into it? Because I'm excited about these test taking strategies that are already in the Oh My God packet on pages 17 and 18. And they're going to make so much more sense when I'm covering them today. So let's start with #1. Listen, I know who you are, and I need you to stop it. Stop changing your answers. You know who you are too. Or answering too quickly, thinking you got this. Listen, beautiful. Listen, beautiful babies. Here's the deal. When you chose that answer, psychology teaches us it's probably the right answer, and 90% of the time changing your answer, unless you've got a real good kick-ass rationale, is probably going to doom you. Psychology teaches us that there's something that came to your mind when you chose that answer that plays a role in your memory that you heard before. So stop changing your answer unless you did something goofy like read it wrong or didn't notice it said needs more information, or some of those catchphrases at the end, what would refute malpractice, you know, that kind of crap. Sometimes at the end of the question, there's something tricky and you just didn't notice it. You didn't notice it, and then you read it again, like I teach you, and you go, oh, ooh, this is ugly. This is not right. I wasn't supposed to answer that. Okay. Now, don't answer too quickly. Slow your roll, baby. Here's what we know, and it's different from what other reviewers will teach you. I'm the only one for 20 plus years that has been teaching you to take your time. Even with the old test, I used to tell my students, if you run out of time during the old test, it's not true with the new test, but it was damn sure true with the old test. If you run out of time, you may still pass. The key is quality, not quantity. So to this end, I tell you to hide the counter, hide the clock, don't sit in front of a clock, don't be anywhere near something with time on it. Get that stupid Apple Watch off, which they probably won't let you take in there anyway, and take your time. What is the goal? The goal is while you're at home all these weeks preparing for this test, that you are literally timing yourself and setting your cell phone for 2 hours. What should be happening at 2 hours? You should be at no more than 50 to 60 questions in 2 hours. Now, why am I saying that? Well, finally, the NCSBN caught up to Shelly. Dr. Shelly, who has a PhD in this and knows exactly how to get you to pass, has done the research, has done the work to figure out why do students fail the NCLEX. And here's what we know. We know that when students go too fast, they miss certain cues and words. We knew that. You know that. We also know that the new test is giving you a maximum of 150 questions. Let's think logically, shall we? Those 150 questions, no matter if you're LPN or RN, are to be answered in 5 hours. So if you, and this is the only math I'll let you do because I failed math and it's an anxiety producer, so we don't want that on this test, so we tell you don't even bother to do the math. But we're going to do one math question today on these test taking strategies. So if Johnny has 5 hours to take his test, and Johnny is given 150 questions for the exam, how many questions per hour can Johnny do? Johnny's ass can do 30 because 30 times 5 is 150. I've been saying that for 20 years before, when they were giving you 265 and it didn't make sense, because I used to tell you, I don't give a shit, take your time. Yeah, it works really well for me. Got a great percentage passage rate. So again, do the math. 30 questions in an hour, 60 questions in 2 hours. You can calm on down and feel pretty good about that alone. And we do not let you study math. And in the rare instance on the new Ngn Nclex exam that you got a math question, you can put 0. You got that from your girl. Yeah. Been saying it for 20 years, even when people got math. I have one of my nurses who's been a nurse so long, she's now a nurse practitioner. She was an RN with pneumonia, couldn't cancel and reschedule her test. So she had to take the nightmarish thing, and all she had for preparation to do really quickly the night before, with her pneumonia having self, because she wasn't going to let that money go. And I tell you, never let the money go. Take the freaking test. All she had to study, like in a real quickie kind of fashion, was the Oh My God pack. And there she is reading that thing from the front to the back, like I tell you. And she was like, oh God, it says put 0 for math. Fine, whatever. OMG. She took her test and she got literally 18 math questions. Now you would think putting 0 is suicidal, wouldn't you? I mean, just common sense. You would think, oh my God, 18 questions and you put 0? Yeah, because I said do it. Why do I know to do it? Because on the website for the NCSBN, it says that math can't help you pass and it can't make you fail. They should have never told me that, because the translation of it can't help you pass and it can't make you fail is fuck it. It's wasting my time. I don't want to do it. So she got those questions. She put 0. She passed that test with her pneumonia having self, putting 0 for every math question. She's now a nurse practitioner, because that was years ago. Have another young lady who was an LPN, and she got 11 math questions. Yeah, my girl, shout out to LaJoy. And what did she do? She put 0 for all of them as well, because she doesn't know math, and neither do I. And I've been practicing quite well without it. In fact, I've never done a math question as a nurse. And I've done it all. Let that hit you in your sad now. I mean, you know what I mean? Like, let it hit you in your sad now, because they told us math was so important. It was all lies. Yeah, nursing schools, if you're out there, stop teaching math. It's really a waste of time, and it's super anxiety producing. Just saying. Telling you for a friend. Okay, so again, don't do the math. It's anxiety producing. I even had one of my students who's adorable, mathematician, teaches math in school. He went to take his test and he said he felt like an idiot not doing the math. So he gets one math question, he does it. He's like, okay, they gave me another one. You're like, oh my God, are you seriously giving me another math question? He does it. They gave him a third one. He's like, Shelly's right, put 0. I'm gone. I can't nobody got time for this. So just know that even that advice may not need to be adhered to at all, because I'm sorry, but I haven't seen much math on the new test at all. Like, I don't know anyone who's gotten more than 1, if that, on the new test. I just don't know of those people. So I'm telling you, our hospitals and our facilities are smarter than relying on human error to do a math question to save our patients. So the likelihood of you using math at work is 0 to none. Now, don't get it twisted. The minute you pass this test, and notice how I'm speaking positively to your cute little self. The minute you pass this exam, you better go back to that test bank and do some math, because every new job you're going to apply for and get, because you're that girl or that guy, is going to have a math test for you to take. So yeah, not for the test, but definitely for the job. Now, that is for your Ngn Nclex. Your HESI and your ATI, you're going to have to kind of study up on a little bit of math and review the concepts and try to kick butt and take names. But even on those tests, you're not going to have to worry that much. So I hope that helps, because it's an anxiety producer for me, okay? Number 2, ooh, this is the most important on the board of all the strategies. Always approach each question in a systematic way. What does that mean? Here we go. Notice the gender if they bothered to put it. So if they said male or they said female, as opposed to just saying client, it's important. Yeah, if it's a female, and get this, it's childbearing age female, then something in that question might have to do with the teratogen, pregnancy, baby, fetus, something. Okay, so watch that. Again, noticing the gender. But what if it's a male? Does that hold any specialty? Yes, hunty, because if it's a male and he is in severe growing pain that just started, it's testicular torsion and it can't be anything else. Yeah, some of you like to call it syphilis. No, syphilis is painless, my love. Yeah, crotch rot doesn't hurt in most cases. So yeah, if it's a guy, they told you male. If it's a guy and they're under 25 years of age, that's why the age always goes with the sex or the gender. If it's a guy under 25 years of age, and it could be a 2-year-old, and they have severe growing pain, oh, believe me, it's testicular torsion. Can't be anything else. I want you to get good at isolating all numbers. What do I mean by that? Well, I really want you to get to the point where you look at the question and you pull every single number out of that bad boy. Oh yes, if you see, for example, because this is something that I find nursing students don't really know. If you're looking at this question and it has some time frames like 1 hour, 2 hour. Oh, honey, that just became who you saw first. There are other ways without using numbers to say time frames, like all of a sudden, sudden onset. That's a timing issue. Sudden, right? Sudden. All of a sudden, sudden onset, on admission, immediate post-op. Those are all ways of saying time frames, and they are always who you see first. That might help. Okay, so that's your time frames. Watch out for those hours. Ooh, tricky. 1 and 2 hours, tricky. Let's look at age. If they give you an age, I promise you it's important. So what if they gave you an age that said under 18, so 16-year-old blah, 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 13-year-old blue, blue, blue. Let me give you an example. Here's a question. 16-year-old Marilyn was admitted 3 days ago with bacterial meningitis. She underwent a lumbar puncture and has been receiving antibiotics since admission. She is, when the nurse walks in, she's holding her head. Her face is down, the room is kind of dark, and she's crying. What is the priority question that the nurse should ask? Well, let's give you some options. Is it, hello, Marilyn, do you have a headache? Or is it, excuse me, but was the light bothering you? Are you having some vision problems? Number 3, excuse me, I need to take your temperature just to make sure you don't have a fever from the meningitis. Number 4, is everything okay? Is something wrong with your friends? Now, I don't know what you answered, but the fact that they told you the patient was admitted with bacterial meningitis and underwent a lumbar puncture and is receiving antibiotics, and they said that she was admitted, and I hope you caught it, 3 days ago. That 3 should have hooked you right on up, because that 3 days ago and the fact that she's on antibiotics now lets you know, and has been, by the way, since admission, it lets you know that visual disturbances, a headache, and a fever are highly unlikely. But then if you picked up on the cue of her age, which was a teenager, you should know based on Erikson's stage of development, which is identity versus role confusion for adolescents, that friends are the most important part of their life, and that she's probably crying about her friends or missing school or something like that. Not a headache, not visual disturbances, not the fever. Because why? Because you noticed they gave you an age, and that age was under 18. And anytime the age is under 18, it's all about growth and development. And just for the record, they also gave you a time frame and said 3 days ago, which anytime they say days ago, it's not a priority assessment anyway. I hope that helps. How about the age over 65? Ooh, this is a big one, because if they tell you the patient's age is over 65, they're checking to see if you know anything about age-related changes. In other words, the geriatric or older patient, older than 65, they are going to experience a tremendous amount of changes over time that affect how you care and approach them. For example, you may have to repeat some things, and you have to analyze whether there's hearing or vision loss. Also, you would want to make sure that you knew as a patient gets older, they make less hydrochloric acid in their stomach, so they don't absorb nutrients very well and really could benefit from a multivitamin. In addition to that, you've got to remember that they don't have as much vitamin B12, and that they might benefit from B12 shots or supplements on that issue too, because without a lot of B12, you can get dementia and neuropathy, two common things we see in older adults. You also have to remember that part of the age-related changes could easily be the fact that the patient may have some aches and pains that they experience when they first wake up, just their joints and maybe a little osteoporosis or something like that. In addition to some of those age-related changes, you want to remember that their kidneys and their liver may not work as rapidly and as efficiently as they did when they were younger. For example, the glomerular filtration rate for the elderly patient is always lower. So sometimes, depending on what medications it is and the patient's weight, you may end up giving half the dose of an adult patient, a 35-year-old. Joan Rivers died because someone forgot that basic fact. Literally, she died during an endoscopy procedure because somebody wasn't thinking that this, I think, 77-year-old woman who's that big, super tiny, may not need the full dose of sedative medications that she got, and the failure to recognize changes in vital signs was part of the charges brought against the people in the surgical suite with her. Not to mention, the anesthesiologists were taking selfies. Okay, I could go on, and there was no consent form. Okay, yeah, and the doctor didn't have privileges to do the procedure in the first place at that hospital. I'm just saying, there are certain things you've got to kind of think about when you're older, when your patient is older. And so when they give you an age and it's over 65, go ding, ding, ding. Shelly's got a geriatric video that describes all the changes to the T that this patient may experience. Here's what you don't want to go into the test believing. Please stop believing that just because someone is older that they're senile. That's ridiculous. I'm always amazed at how the current climate is, talking about our current president as being so old, but you're perfectly okay with the fact that you can serve on the Supreme Court until you're 102 and be a KKK, a Ku Klux Klan supporter as well. Just in case you don't know your history, that would be Strom Thurmond. Yeah, nobody talked about his age. They allowed that KKK supporter to serve until pretty much he died. Just saying. Yeah. All right. So if the number, because remember, we're trying to isolate the numbers, right? So we did our time frames, we got the age. Let's look at those vital signs. You guys love vital signs. Well, you know, the vital signs are not what you think they are. No. In fact, if you're like me and you learned some garbage about the ABCs, you might be thinking when it comes to vital signs that the patient's respiratory rate is the most important. Part of my drama with you guys and these vital signs is having to teach you, literally teach you, that there's still just 4 vital signs. Yes, what 4 vital signs are there, Shelly? Well, let's go, y'all. Blood pressure, pulse, respirations, temp. If it helps you to think, sometimes people go, they go TPRBP, right? So temp, pulse, respirations, blood pressure. Y'all always want to put the pulse ox in there. And while the pulse ox is really important, it's not an actual vital sign. Okay, so you've got to focus on the 4 vital signs. But if you're thinking like I did when I went to school, that ABCs is how you prioritize, you might get into trouble with this one. Because to be honest with you, the least important vital sign is the respiratory rate. Oh, well then what's the most important vital sign? The pulse. The pulse. Now, what about the pulse makes it so critical? Well, let me tell you something. If the pulse is above 110, it's a bleed until you prove it's not. It's damn sure who you see first. And what makes the pulse so special is that the pulse will go up first in most medical emergencies before the blood pressure changes. People forget that about shock because we always say with shock, all blood pressure low, and it doesn't matter which shock it is, it's all blood pressure low. But with some shocks, the pulse is going to shoot up first, especially hypovolemic, especially septic shock, especially cardiogenic shock. These shocks will show you very clearly that the pulse will go up before the blood pressure does anything, okay? Now, I do want to share with you a little love bug kind of hookup, okay? There is one body system where typically the pulse is low in medical emergencies, and that is the neuro patient. Yeah, the neuro patient will oftentimes have a low pulse. So if you're talking about the patient with Guillain-Barré, low pulse. If you're talking about the patient with autonomic dysreflexia, low pulse. If you're talking about the patient with a Cushing's triad, increasing ICP from head injury or traumatic brain injury, low pulse, okay? So I really want you to remember that typically the pulse is the most important vital sign, and the high pulse means the patient's bleeding until you prove they're not, and that the low pulse is typically another little heads up. This might be a neuro emergency, okay? Now, again, all of this stuff is in the Oh My God packet, not just on page 17 and 18, but I give you a whole list of what vital signs to be worried about. Now, of course, the blood pressure is important. And when we're talking about blood pressure, less than 90/50 is an emergency and maybe shock. Septic shock, hypovolemic shock, distributive shock, cardiogenic shock, right? Or, get this, a blood pressure higher than 180/120, and please don't forget I said those numbers, so let me say it again. 180/120 is definitely stroke material, and you need to treat it as a medical emergency. What do I mean by that? Well, I mean the fact that when my student told me that her aunt went to a hospital in the community, a clinic appointment at a hospital type setting, but it was a clinic outpatient appointment, and she was excited because Obamacare had just came out and she qualified. So she went for her very first physical. She let them know because her niece told her, don't forget to tell them about your headaches. So she told them about her frequent headaches and how bad they've been. And interestingly enough, the clinic took the blood pressure, wrote it down on the back of a business card, and that's how we know that the blood pressure was 200 over 110. That's how we know. And the business card that they gave her was a referral to the neurologist, but they fucked up because they let her leave that outpatient setting without evaluating in what was actually a hospital building, without having her go to the emergency room for this outrageous stroke level blood pressure. Now, how do I know so much about it? Well, this nursing student told me that when she was found dead, having stroked out in her apartment, her aunt, there was a card in her pocket that had the neurologist. She was found dead that day as well, by the way, just so you know. Later that evening, she stroked out. So the card with the neurology referral, the back of the card with the blood pressure on it, and then the problem list from the paperwork she got from the clinic, headaches, elevated blood pressure. I mean, just open and shut case of neglect. So again, 180 over 120 is to be addressed immediately. Separate numbers on your test. Look at numbers the longest. They mean something, okay? Now, electrolytes and coags also are very important. Watch that sodium, calcium, and potassium. And then when it comes to coags, watch that PT, PTT, INR, and platelets. All right? Oh, and watch that mag sulfate, because that can give you torsades, and they like torsades on the EKG. All right, now, number 3, review options from the bottom to the top. This is quick and easy. One of the problems is they know that students, when they look at all the answers they could possibly choose, they're going to go from the top to the bottom. Not you. You're prepared. You know your shit. And you know that that's just an NCLEX trick. And you need to go from the very bottom of the options and go up, so that you don't miss that very bottom while you're going to the top thinking that looks like the answer. Now, you know how we do select alls. I tell you with select alls, you just isolate each one of them and say true or false, number 1, in your mind. Is it true or false? Just one question at a time. Stop looking at the list. One option at a time. Is it true or false? And then say for the second part of your question, your analysis of the select all, did Shelly mention this in class or on one of her videos? Because if I've never heard of it, I probably don't need to click on it. That'll hit you Tuesday. All right. Number 4. This is specifically for LPN to RN students. You have a high failure rate for several reasons. Number 1, you considered your LPN test to be easy. You thought this one would be easy, and you didn't really study a whole lot because you are, number 2, working too much. But then number 3, this is you. Leave your work at home. What you do at your job right now, LPNs and to a lesser extent, nursing assistants, but for sure LPNs, is probably substandard, probably even completely wrong. Why? Because many LPNs work at a long-term care facility where they cut corners, break rules, because these are residents and not necessarily acute patients. And so there you are at the job doing A, B, and C all day long the wrong way, and you take that to this test and they're like, get the hell out of here. That's not what we really do. The other problem is the LPN often went to abbreviated bridge programs. You know what that means, right? That means that all of the basic stuff that really matters, like procedures, they're going to skip over that and assume you know. But if you're honest, you don't remember that because you've been an LPN for 4, 5, 10 years and you just don't remember the basics, and that's okay. But then everybody's going to these accelerated programs, and then what they find is that they're completely inadequate and they fail. I see it a lot, okay? All right. I know this is going to sound crazy, but the next one says, keep smoking and watch your sugar. Oh, Shelly, you're a nurse. How could you tell people to keep smoking? Listen, let me help you with this. Don't do any dramatic changes, okay? Don't suddenly decide to go keto. Don't think maybe today's an intermittent fasting day. Don't think, oh, I'm going to be a nurse. I got to stop smoking. Let me stop sniffing this cocaine and playing in the snow. Maybe I need to let this heroin go. No, stop. No, honey, let me tell you, keep doing your cocaine, go on to shoot up your heroin, smoke your pot, broccoli, whatever you call it. Do you, boo? Because major changes before the test, like all of a sudden, I think I'm going to stop drinking caffeine. Oh my God, are you crazy? Like, you know what's going to happen? You're going to be a maniac. You're going to get a severe headache that you can't even think through if you stop smoking right before your test, stopped caffeine right before your test, decided to cut out a bunch of sugar. Now you're going to get Charlie horses and cramps. Your K will probably be a little bit low. Or like intermittent fasting, now you're sitting there and your stomach is growling and it's louder than anybody in the room. I mean, what are you doing? Cut it out. Keep it simple. No. Do not make major changes before this test. However, let's holler at my friends. This is not the day to go to Dunkin' Donuts and get glazed donuts and that sugary coffee. This is not the day to go get those hot Krispy Kremes that I love so much. No, this is not the day to pack a couple of packs of peanut M&Ms and think, deuces, I got this. No. Well, what should you do? Well, frankly, you want to know what I would suggest? Cheese sticks, bacon and eggs, hard boiled eggs. Notice what I'm doing. Protein. Yeah, really high. And I didn't say a protein bar because that's trash. I say a really high protein. Yeah, this is really important that you focus on toasted cheese or bacon and eggs or sausage. Even a sausage McMuffin is better than a freaking donut or a bagel. Donuts and bagels, no, the day of the test. That shit's going to make you crash in about 2 or 3 hours glucose-wise, and then you're going to be tired and sleepy. No, you've got to bargain for the long haul. You've got to prepare like, hey, I could be here all 5 hours. Yes, Shelly's stuff prepared me well, and maybe I'll just be 85 and out like most of the people in her class, but maybe I'll be 150 and 5 hours in, and this is not going to feel good at all to be crashing 2 to 3 hours in when I need my brain cell activity. Now, if you want to be a super brain, because I consider myself a super brain, the reason why I am a super brain is not because I'm like a genius. No, it's because I do intermittent fasting, low carbs, but I didn't do it the day of the test. I didn't do it the week of the test. You'd have to put that shit in place 30 days or more before the test. And it does work. Dr. Jason Fung is the person I follow. Intermittent fasting, low carbs, boom, power brain, okay? You really do well with concentration and you are amazing at tests, okay? So that's just a holy hookup. While you're at the test, hide the question counter and the clock. I don't need your anxiety peaking. I need you to chill. So get rid of that stupid clock. Get rid of the counter. Get rid of the Apple Watch. Anything that's going to make you know how long you've been there, what you've been doing. I need you focused on those questions and doing your analysis like we talked about. Number 7, you've heard this from everybody. This is not new. You're going to need to do 500 questions a week. But here's the thing. People really get this wrong. When you do your quizzes, because I call them quizzes, I don't call them tests. These are practice quizzes. The reason why I call them quizzes is because at no point in your life when you prepare for this test should you be doing all day long tests of 50, 60, 85 questions a test. No. You should be doing small, bite-sized pieces of test, but all day long would be just fine. Let me explain. Let's say you're off tomorrow and you're going to dive into this test and you're going to study for it the way we tell you, one subject at a time. And you decide, I'll be damned, I got the whole day off. I'm about to bust a move. I'm going to do at least 15 to 25, maybe 30 tests today alone. All right, that's cool. But what is the maximum number of questions on each test that you do? No more than 25. Yours truly does no more than 5 to 10 questions in a quiz. So if you do 15 or 20 or 30 tests, hopefully they're just 5 to 10 questions per test, because it's at that point that I want you to review the rationales and take notes on the rationales. And the reason why you want to do one subject at a time is because unless you have my program, you should have bought, because I tell you, if you don't have some of the stuff in my program, like all the handouts, you don't need that shit. But if you did want that, we have it and it is wonderful, but you don't need it. Okay, so like if you needed to use a 5-subject notebook, it's very simple to keep all your subjects in a row if you make sure that you take notes on the rationales right after your test. For a lot of you, it's better when you're taking the notes on the rationales to have the timed questions during the actual quiz. If you look at UWorld, there's a thing called tutor and timed. If you take it off tutor, you can just do the test and then you can go back and look at the rationales. If you have plenty of time and you can sit there and really learn, then obviously do it in your tutor mode so you can get the answers and the rationale to the question at the same time. But the closer you get to your real test, do more timed than you're doing tutor on the UWorld that we like to use, okay? Now, here's another thing. You need to do the UWorld assessment first. So you're going to get a bunch of RN assessments, and we only use UWorld RN because we're preparing you to pass. I don't care that you're taking an LPN exam. We only use UWorld RN. Now, again, I'm the one with the PhD. You could take this advice or leave it, but I kind of did this for a living, and I kind of went to school to learn to do it the best, and I am the best. So listen, I've reviewed all these stupid softwares and the UWorld software, and people are like, it's expensive. Well, you get what you pay for it. Every day that I do consultations, I talk to people who failed using Archer because it's too easy and too basic and very deceiving in the fact that it tells you you have a good chance of passing with a score that is not passing anywhere in the United States. So I'm telling you that UWorld RN is the method of studying that I promote the most, and no, I don't get a kickback from it. I wouldn't take one if they offered, because I like integrity and I don't want nobody buying my opinion. So that's why you get me raw like I am, because I'm telling you what the hell is the truth. So the UWorld RN, when you're looking at this UWorld RN and you're reviewing the rationales and you're looking at time quizzes, don't do any of that until you do one of their assessments. Well, they usually give you 2 or even 3, but the UWorld assessment has 100 questions. You're not going to play with that. You're going to sit your butt down, and when you get time, and you know what I said about 100 questions, right? If it's 30 questions per hour, you need a good 3.5 hours to do those questions. So you're going to do those questions, and you're going to see, where did you start at? Did you start at 40% or 30? Then you're going to need a lot longer to study. Did you start at 60%? Then you're going to need a lot less time to study and a lot less resources to buy. But if you have failed 1,000,000 times and you got 60 and you used UWorld before, that score is inflated anyway. So there's lots of different things, and all of this is in my videos under the NGN tips playlist, self-study tips. So don't worry about it. You'll hear it again. But so that's the thing. Do the assessment, see where you are, right? I mean, come on. All right, now let's go because we're almost done here. Number 8, please stop calling the doctor. Yeah, I need you to stop calling the doctor because this is a nurse's test. The average amount of time on the entire exam that you need to be calling a doctor is 1. That's it. Quit calling the doctor. We ain't trying to find out what the doctor know. We're trying to find out what your ass know. Stop calling the doctor. But let me give you 5 reasons why you might want to call the doctor first before you do anything else. Let's go. I use the mnemonic of R, E, C, C, C. In class, we call this Reese's. So we call this Reese's, R-E-C-C-C. Now, these are 5 reasons why you absolutely want to call the doctor first. The R is for ruptured uterus. Yeah, the uterus has ruptured. The baby is free floating. You can't do shit about it. You need to call the doctor first because she's essentially bleeding with the baby just free floating and not having any kind of oxygen. So you need to call the doctor because you can't do anything to make that situation better. She needs an emergency C-section. Number 2, the E is for epiglottitis. Epiglottitis is seen in toddlers. It is a life-threatening obstruction. This kid can't lay back, can't put anything in their mouth. You can't take an oral temp. You can't rush them in for a throat culture. You can't lay them back, cradle them, none of that. No, what you need to be doing is calling the doctor first and getting a trach set at the bedside because they need to be intubated. All right, let's keep it moving. 3 C's. Let's do the first one. Let's do cataracts because there's 3 C's. Cataracts, right? Cataract surgery is the #1 surgery in America. It's very safe. But if following cataract surgery, your patient has some complaints, and it don't matter what the complaint is, you need to call the doctor. Everybody need to call the doctor behind that because typically the #1 complication after cataract surgery is a detached retina, which is a medical emergency anyway. And there may not be a lot of pain with that. It's just, it is what it is. So complaints after cataract surgery, call the doctor. Let's do another one. Compartment syndrome. Now, this is a big one. Compartment syndrome is a call the doctor first unless it's with traction. So let's do the one that's called the doctor first with the cast, shall we? Your patient has a cast, and if your patient is complaining about anything outside of itching in that cast, it's compartment syndrome. Let me say that again. Your patient has a cast, and your patient is complaining, and the complaints they have is not itching. I don't care what the complaint is. Unless it's itching, it's compartment syndrome, y'all. Like, just take my word for it. Now, so call the doctor. But I said, if it's compartment syndrome with traction, nurses, especially those who failed their test before, because this is a question you're going to get. If it's with traction, the answer to that question for the first nursing action is not call the doctor. It's remove the weights and then call the doctor. All right. The last C is an easy one. It's the consent form. You know, if you look at my management of care videos, that the consent form ain't no joke. And if the consent form is not signed, then that is actually a reason to cancel the surgery. You try your best to get it signed. You even try your best, more importantly, to ascertain if this patient knows what's going on. But as I so eloquently stated in my other videos, I was floated to ambulatory surgery one day where a patient was having a vag hysterectomy, and I went in there and introduced myself and said what every nurse should say prior to surgery. So what are we doing for you today? And she said, and I quote, "Y'all about to fix my periods." The doctor said he about to fix my periods. I said, well, if we do a hysterectomy, when we take your uterus out, that damn sure will fix your periods because we ain't about to have no more periods after that. And she looked at me crazy and said, wait a minute, what? take my uterus out. No, y'all ain't, I ain't sign up for that. The doctor ain't tell me nothing about taking my uterus. Oh, really? Hold on. Dr. So-and-so, the patient in room 4, you know, the vag hyst, she said that you didn't tell her anything about taking her uterus out. And you know me, we ain't finna do no surgery in a patient that's clueless. So you might want to come on out here and talk to this patient. Oh my God, I told her that she was having a hysterectomy. Oh, for real? Because she don't understand that at all. He goes in there, starts yelling at the patient about her having a hysterectomy, and she knew that, and I told you. And guess what she did? Honey, she started yelling back at him. You ain't told me you was taking my uterus out. No, you didn't. You told me you was fixing my periods. That's what you told me. And she and her uterus got up and walked the fuck out of ambulatory surgery. Oh yeah, because guess what? She wasn't for that. She figured if God put it there, let it stay there. She wasn't having it. So, consent form is a major emergency. And nurses, don't be witnessing shit you didn't see. Yes, you are to witness the consent form only when you saw the doctor giving informed consent. I'm telling you, y'all, that's a major one. That's a call the doctor first and consider canceling the surgery. Okay, so that's that. Next is avoid absolutes, unless it's a safety issue. You know what I'm going to say. You've heard other reviewers say it. Things like at all times, only, what is it? Always, all that kind of stuff. Come on now. You know better than that. Don't be an absolutist, I tell you all the time. So be careful with absolutes. But here's some examples of when absolutes really do matter. If you're an asthmatic, you're supposed to carry your bronchodilator at all times. If you have nitro and the doctor told you to use it for chest pain, you're supposed to carry that nitro at all times. So be careful. Safety issues, life-threatening issues, EpiPens, bronchodilators for asthma, nitro for your cardiac patient. You might need an absolute for that, all right? Next, I know. Are you sitting down? Yeah, because this one really makes you mad. Forget ABCs. Airway, breathing, circulation does not work. You know how you really know it doesn't work? Because I'm about to renew my ACLS. You know how you know it doesn't work? Yeah, because even CPR changed it to CAB. Yeah, did you notice that? That CPR or BLS or ACLS, instead of doing airway, breathing, circulation, they do circulation, airway, breathing. Yeah, you used to go and have to puff in the mouth. No, we now do chest compressions. This is how you know the ABCs don't always work. Now, it is true, and I want you to hear me on it, that if something, watch my hands, if something happens between my sternum and the top of my head, it's probably a priority patient. But it may not be who you see first if you see these words instead. Come here, come here, come here. Get your butt over here. By the way, they're in the Oh My God packet almost on every page. But I'm just going to give you the words myself because I love you. Restlessness, emergency. Anxiety, emergency. Irritability, emergency. Apprehension, emergency. Altered mental status, emergency. Confusion, depends on if they was confused all along or if this is a status change. But if it's a status change, that's an emergency. Feeling of doom, ooh. Agitation I have right here. In other words, beloved, these words are behavioral changes that tell you your patient's not getting a lot of oxygen to the brain, and that's why they're having them. So that's huge. Okay, here we go. Number 11, focus on what the question is asking. Well, how do you do that? Well, here's the way I do it. I read the last 5 words of the question first before I read anything else. This is how you miss, if you're not careful, what the question is asking if you don't read those last 5 words first. Then read the question twice. The first time you're just reading it, but the last time or second time that you read it, you've taken the answer that you chose and put it in the question to see if your answer really answered the question. One of the things that you get mixed up on a regular is signs and symptoms and risk factors and causes. So common with nursing students. Be careful. Now, here we go with this. Be aware of vocabulary words. And I got to tell you, this is directly related to my PhD about reading comprehension. Many students read the question and they don't know some of the words in the question. And the words that they don't know in the question are not nursing terms. No, they're basic comprehension that you only get from being an avid reader starting at 3rd grade and up. So if your kids aren't readers and instead they're video game players, they're going to have a problem, because what we see is there is a very, very low reading ability in some students, especially if you went to a poorly performing school and then you went to a really shitty nursing school. You may not understand how to read much of nothing. And so you get to that nursing exam, and let me tell you 2 words to throw you a curved ball. The word refute and negate. It may say something along the lines of, which comment below by the nurse in her documentation negates the charge of malpractice. It may say which comment in her nursing notes refutes the charge of negligence. Well, those 2 words means doesn't agree with negligence, doesn't agree with malpractice, goes against the charge. Be careful, okay? All right, now, number 12. I know test anxiety is a big one. Let me just tell you about test anxiety. First of all, knowledge is critical to diminish test anxiety. Sounds common sense, but not really unless you really go there with me. Let's take it all the way there, shall we? If I ask you right now, what is 2 plus 2? You're going to look at me cockeyed and crazy and be like, bitch, it's 4. Yeah. Did you sweat? Did you have bubble guts? Are you experiencing diarrhea and tachycardia? No. Because what? You knew it so well that you didn't even have to work at it. You didn't get anxious about it because you've studied this and known it for years. But wait a minute now. Let me help you with this. You did not come out of your mama's uterus knowing what 2 plus 2 was. You had to study. You had to look at flashcards. You had to do some work to learn it. And now your little 30-year-old behind being like, 4, bitch. Yeah, well, you're right. It is 4. Guess what? The nursing concepts, you're going to have to work at it. And you're going to have to know it so well that you go like, bitch, that's so-and-so. Yeah, because it's when you sit down for this test that what many students don't know is when they first sit down for the test, the hardest questions in the test bank are coming to you. Yeah, no, I'm serious. The hardest questions in the test bank are in the first hour that you sat down. And so what does that do? That produces massive anxiety, and there you're a piece of shit for the rest of the test. I get it. You don't know the first question. You think, okay, that was a fluke, and you get the second one. You still don't know that one, and you get the third, and you're like, I'm fucked. I don't know that one either. That is high anxiety. So before you do all of that, make sure you take time out to really know your material. That's what I preach, baby. And let me tell you something to get you. I've had one student after another. I must have been messing it up because they kept giving me the same kind of question. Be careful with that. Be careful with thinking that you got the question wrong because they asked it again. Here's what they're really doing. They're asking you the question the first time, see what you answer, come around 5, 4, 5, 6 questions later, ask that same damn question slightly differently. Here's what they're saying. Do you really know the answer, or did you guess on the first answer? Because if you change your answer the second time they ask you this question, your ass ain't know it anyway, because you let them trick your behind up out of the right answer. Be careful when they ask you something over and over. It may not be that you got it wrong. It may be that they want to see who's guessing and memorizing versus I know my shit. I'm not changing my answer. Okay? Number 2, medications and herbs. There are several medications and herbs that you could use to address test anxiety. Valerian root is wonderful. It's going to help you sleep better, and you need good sleep before this test. Do not do any of these different things without talking to your doctor. Do not do any of these different things that I'm talking to you about without doing it 30 days in advance so that you get used to what you're going to feel. So again, valerian root is going to help with anxiety and sleep. St. John's wort, again, talk to your doctor, is going to help with anxiety and depression. In fact, in Europe, St. John's wort is actually more popular than our stupid SSRIs that we have here and cost you an arm and a leg. It's over the counter St. John's wort, but it's like an MAOI, so there's that. Now, so they say. Number 3. You have to remember when it comes to prescription meds, because those 2 things were over the counter. Oh, and don't forget melatonin. And some of you guys use melatonin completely wrong. Melatonin is a hormone that you need to ingest somewhere around 6, 7, 8 o'clock. And then your little ass need to be in bed, okay? You can't take that at 11 o'clock at night and think that that's going to work for you. No. Melatonin has to be taken relatively early. Again, 7, 8 o'clock, never later than 9. I don't like 9 at all. I don't think it works as well. 3 milligrams is a real cool little dose. Don't go crazy. Okay, but anyway, prescription meds, let's do that. 0.5 of Ativan, which is a benzo, so stay away from it if you can, but then sometimes you can't, so I just gave it out there to you. You got to talk with your doctor. And then, of course, you have your propranolol. Remember, propranolol is a beta blocker that's approved for test anxiety, and the only problem with it is if your blood pressure is already low, you don't qualify. However, if you didn't qualify for propranolol, maybe 5 pills max of 0.5 of Ativan will work for you in terms of the test. You take that 0.5 of Ativan a half hour before you walk into the test, and you usually do pretty good. But you've got to have a relationship with your doctor so they don't think that you're the new dope dealer in town asking for Ativan. Okay? All right, now, imagery. Imagery is set yourself up in advance for this test by acting like you're always at the test. Okay, so here's what I mean. Some of y'all take your little U-World, you do some on the couch while you're watching Netflix. You in the bed doing something, waiting on your man to come to bed with you. You do some in the kitchen while the kids is eating dinner. You go ahead on and do some in the car. I ain't mad that you're doing them like that, but you've got to take a minute out of your time and strategically make sure you do a real test, like 25 questions, more than 5 or 6 or 10, 25 questions in the same seat, in the same room, under the same environment every single time, and pretend like you're at the test. When you go to the test, I want you to remember the wallpaper in that room where you sat in that same seat every single day and did them same 25 questions. I want you to remember the temperature of the room. I want you to remember what you wore in the room. I want you to think about the fact that this is just in my kitchen where I do this shit all the time. I ain't finna let the fact that I'm at a testing center be all up in my mind and trip me out. It's called imagery, and you've got to do it, and many students do well with it. All right, now here's another one. When the test does not shut off, because for many of you, it won't. When and if the test does not shut off at 85, making you think, oh my God, I'm a nurse. even though you can fail an 85 too. If it doesn't shut off, this is what you got to say. Keep it simple, Shirley Temple. This is what you got to say. Okay, Dr. Shelley said, as long as they're giving me questions, I'm still a nurse. I've just got to stay in the game and not lose my damn mind because they're still giving me questions, which means they still think I have a chance. Let me stay focused. These are test-taking strategies that work. You tell me that they work. Let's do some more. Prepare for the entire 5 hours. If it's summertime, don't be up in that motherfucker with some shorts and a halter top on and some sandals. You gonna freeze your ass off and you gonna hate your life for 5 hours. Because after the first hour, when that shit feels so good because it's so hot outside, that shit gonna feel like crap. Honey. Take you some tennis shoes, wear your damn socks, put on some pants and a nice layer of clothing that is easy to change in and out of in the locker room or whatever you can do to make sure that they don't think you're sneaking like answers and shit through there. Don't wear them tight ass bras. Put your tits in a t-shirt. That's more comfortable. I'm just saying, I don't know about you, but I think that bras are barbaric. And if I could go braless and have the girls out all day, it would be great. All right. Now, here we go. Oh, and take you some food, boo. Take you some cheese crackers or some peanut butter crackers or some bag of turkey. Turkey is really good. A baggie of turkey. There you go. Get your turkey. Okay. Watch The Secret. Oh my God. Either go to YouTube or go to Netflix. It's been on both. The Secret is by Rhonda Byrne. It is the most positive way to get your shit together and get your mind ready for the fact that you're a nurse. You cannot take this test with that negative shit you got going on. That stinking thinking will make you fail. You see, it's called a self-fulfilling prophecy. I know I'm going to pass this damn test. Is how you pass the damn test, okay? So that's how you do it. You watch The Secret. It's called The Secret, okay, by Rhonda Byrne. Now, 7. This is the most important of all. I'm sorry, y'all. I don't know if you know or not, but I'm a God's girl, so prayer, oh, hell yeah. Prayer works. I just believe in my heart that there is no perfect example, no more perfect example of this than my wonderful student, Jamila Pace. Jamila ain't no joke. Jamila met me and she told me that Metro Health Hospital or somebody had told her she was a little bit learning disabled. She had an IEP in school, so she was special ed sort of kind of way. And then she really had a hard time learning. She's an LPN. She went to LPN school. She had a hard time getting out there and graduating. Then she came to my class and she was right. She learned and it took a long time. How long did it take her to learn the concepts of how to be the nurse? And she's one of the best nurses I know, by the way. It took her 1 whole year in my class. And it was really scary because when she went to go take her LPN test on 10/10/10, she wrote a letter to God. October 10th, 2010. The original letter is in my Bible. In the letter, she said, "Dear God, I am going to be a nurse on 10/13/2010 if it is your will for me. This is what I want on my test." And she made a list of all the crazy stuff. She was so ridiculous. She wrote, select all for Cushing's, select all for Alzheimer's, select all for chickenpox. She put the select alls that she wanted. She put all the stuff that she wanted. She had a 1.5-page letter. And at the end, she said, if it is your will for me, I will be a nurse. And then she signed it, Jamila Pace, LPN. Amen. Swear to God. Now, that girl passed that test barely. She ran out of time and everything, but she passed that test. She defied the odds, and she's one of the best nurses I know. Shout out Jamila Pace. Okay? Now, so prayer does work. Now, number 13, special accommodations. I talked to a nurse. She has dyslexia, but she didn't get special accommodations, and she failed. I talked to her myself. You guys, if you have ADHD, dyslexia, apply for the special accommodations. It is your right because these are disabilities and we have to accommodate them. Now, number 14. Only use 3 resources. Stop using 700 different resources on YouTube, 50 different test banks, all this stuff. When I talk to you, you tell me you use Archer, you tell me you use UWorld, you tell me you use Simple Nursing, you tell me you use Remar, you tell me that you use Climate videos, you told me that you got the books from him, you tell me that you use Saunders, you tell me that you use, what is the other one? High Yield. You tell me that you did all this stuff. Here's the deal. There's some excellent resources out there, but you got to cut it down to 3. 3 things that you're going to use consistently every single time. Here we go. You need a test bank. And I'm sorry, I'm going to say it again. The only one I swear by is UWorld. Shoot me. If you have Archer, you already bought Archer, don't just throw Archer away, but understand that your scores are inflated and they don't mean much, or at least make sure that you know if you get a score of 68% on Archer, it's probably really only 58, okay? But it's just a piece of crap. It's too basic. I know it's cheap, but it's too basic. Now, this UWorld RN, never LPN. Even if you're taking an LPN exam, never buy UWorld LPN. YouTube videos. I don't care if you use me. I do feel strongly that 400 plus videos for free is amazing. And so I do encourage you to think about us because we have it organized by playlist. So you get every body system plus the test taking tips and everything else. So if you don't use HETV, it's absolutely fine. I personally have looked at other people's videos. I think that Level Up is good. Simple Nursing is wonderful. Registered Nurse RN is great, but here's our problem. What I have noticed, and I don't know if you've noticed, these videos are old. Oh, yeah, they're still using Mona for MI. Remember Mona? Morphine, oxygen, nitrogen, and aspirin. Oh my God, like we do not do Mona. You know what we do for the MI patient? Aspirin and an EKG and get their asses to the cath lab. We don't do no morphine. We do nitro, but we don't do no morphine. And we damn sure don't do oxygen unless the pulse ox is less than 90. You guys, outdated information will kill you. It will just be the death of you on this test. So if you're looking at a video and it says 8 years, you probably need to stop looking at that video. Cut it out, okay? Written resources. Written resources are really nice. I know that this is a big online telecommunication world we live in, this digital society we live in, but don't nothing beat having it in your hand because I sent it to your email, you printed it out, it's in your hand, you got your highlighter and your colored ink pens, and you are highlighting and taking notes. Nothing beats that. Research, you know, the PhD, research shows nothing is more effective than that. So think about it. Now, here are some special circumstances and then we're done with our test taking strategies. Here it is. If you're pregnant, don't take this test in the first trimester and try not to take this test in the last month of pregnancy. I would rather you wait till you're 8 weeks postpartum or even 3 months postpartum. Most states, the test does not expire for 6 months. You guys are in a hurry for no good darn reason to be out here with all these old crazy nurses and not know shit. But you need to pump your brakes if you're pregnant, especially in the first trimester. The best time to take a test is 16 to 32 weeks in pregnancy. The next issue, recent death in your family, reschedule. Divorce, you were served with divorce papers or you just broke up with your baby daddy, reschedule that bad boy for 30 days later. I'm just saying. Now, what I have just given you were the test taking strategies that are on page 17 and 18 of the very famous Oh My God packet. This was a long video because these are huge test taking tips that you just gotta know. Now I've got one more thing before I sign off and say sayonara, and that is you need to be selfish. Yeah, let me explain. You've got to put you first. This is not the time to volunteer at the church to make the chicken for the chicken sale. This is not the time to be the PTA chairperson. This is not the time to sign Bebe and Bam Bam up for every after-school event you can think of. You are not going to be a taxi mom during studying for this test. Just stop the madness. Yes, you see, here's the deal. If your kids are calling 696 Kids because you're making them eat peanut butter every single day, you're on the right track. Peanut butter and jelly never killed anybody. If your man is filing for a divorce because he's sick of your shit, you're on the right track. If your parents are threatening to take you out of the will because you ain't seen them since months of Sunday, yeah, you got this. Yeah, because all of these people with these little problems, they will be fine. And you can help them a lot more when you're an RN or an LPN. You must be selfish. And if you sleeping with the enemy, get that motherfucker out your bed, honey. Time to break up with his ass. Love you. Deuces.